Assalamu alaikum. In this part of our discussion, we will discuss the anatomy of the medial side of the thigh, of the medial fascial compartment of the thigh. First, muscles. Gracilis muscle, adductor longus, adductor brevis, adductor magnus muscle, and obturator externus muscle. Blood supplies coming from obturator artery and profunda femoris artery. Nerve supply coming from obturator nerve. Note: adductor magnus muscle is a large triangular muscular sheath consisting of adductor part and hamstring parts. The adductor hiatus is an opening or a gap in the attachment of this muscle to the femur, and this opening permits the femoral vessel to pass from adductor canal downward into the popliteal space. This is the adductor magnus muscle. As you see, large triangular sheet of muscle attached to the medial aspect of thigh. It has a small opening lower down called adductor hiatus, and also it composed of two parts, adductor parts and small hamstring part or extensor part. Blood supply to the medial fascial compartment of thigh. Profunda femoris artery. Profunda femoris artery is a large artery, arises from the lateral side of the femoral artery and the femoral triangle below the inguinal ligament by about 4 centimeters, and it descends in the interval between the adductor longus and adductor brevis muscle and lies on the adductor magnus muscle, where it ends as fourth perforator artery. Branches of this arteries: first, medial femoral circumflex artery; second, lateral femoral circumflex artery; third, perforator arteries, which are 4 arteries. 3 of these 4 arises as a branches of the main trunk of profunda femoris artery, and the 4th perforator is actually the continuation or the terminal part of the profunda artery. The perforator arteries, they run backward and piercing various muscle layers. They supply the muscles and terminate by forming anastomosis with one another and with inferior gluteal artery and circumflex femoral arteries above and muscular branches of popliteal artery below, means anastomosis around hip joint and the knee joint. Profunda femoris vein. Profunda femoris vein, it receives tributaries corresponding to the branches of the artery, and finally it will drain to the femoral vein. Second artery in the medial compartment of thigh is the obturator artery. It is a branch of internal iliac artery, and it passes forward on the lateral wall of the pelvis and accompanies the obturator nerve to pass through the obturator canal in the upper part of the obturator foramen, and on entering the medial fascial compartment of thigh, it divides into medial and lateral branches, which passes around the margin of the outer surface of the obturator membrane, and it gives off muscular branches and articular branches to hip joint. obturator nerve. The obturator nerve, it arises from the lumbar plexus. It emerges on the medial border of the psoas muscle within the abdomen, runs forward on the lateral wall of the pelvis to reach the upper part of the obturator foramen, where it would divide into anterior and posterior divisions. The anterior division passes downward in front of obturator externus muscle and adductor brevis muscle. It gives muscular branches to gracilis, adductor brevis, adductor longus, and pectineus muscle. The posterior division, it pierces the obturator externus muscle, passes downward behind the adductor brevis muscle in front of adductor magnus muscle, terminate by descending through opening in the adductor magnus muscle to supply the knee joint. It gives muscular branches to the obturator externus and adductor part of adductor magnus muscle.